Hi, welcome to Healthy Living. I'm going to go over this patient right here. And you can see there's two things that this patient had. Well, a couple of things. Okay, first of all, this patient previously had an amputation of the big toe because of a sore. And this patient actually had all the toes that were curved down, and now he has this toe that's kind of sticking up. So basically the toes are curved down, and there's one of the toes that's sticking up like that. And you might wonder how that happened. Well, if you look at the tip, there's a little callus around the area, and there's a little area where there was a wound. And he had developed a wound because all the toes were curved down, and they were hitting the shoes, and they caused something called an ulceration. And that's actually the same reason he lost this toe, because that ulcer got infected, and it infected the bone, and he had to have that toe removed. We didn't want that to happen to this toe. And so there's two different types of toes that are curved. There's something called a flexible hammer toe, and there's more of a rigid one. And the way I explain that is if the toe is rigid, I can't straighten it with my hand. But if it's flexible, I can straighten it out. And his was flexible. I could straighten it. And the type of treatment that we used for this patient is actually we just took a pin and we stuck it right underneath the toe, so right kind of in the crease. You stick it in there, move it back and forth, and you cut the tendon. And you splint the toe up like that. So that it looks like one toe is straightened, and this ulcer is going to heal probably in a couple of weeks because there's no pressure on it. What's the concern of this? Well, you see these other two toes that are sitting next to it, the second one and the fourth one? Well, those are still curved down. And if he has too much pressure on those, they could possibly develop the same callus and develop a sore on those as well. So this is something that's a difficult problem for this patient that we're treating. Another thing, I don't know if you can see this down here. See this little callus that's underneath the big toe joint? Well, that callus, you can see another example right here. It has a little bit of a cut on the side here. And the way this is treated is you treat it by trimming down the callus, and you put him in a special shoe that's going to help take the pressure off of the area. So this is kind of a difficult foot to treat. We're treating it piece by piece, and this is something that you're going to need follow-up care about every 2 months with the podiatrist, just to make sure that there's no future problems. And this patient as well would do very well with some type of a diabetic shoe to reduce the friction on the bottom of the foot. Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.